Okay, thank you for coming back to watch my videos and subscribing to my channel. I'm so grateful. And as we are getting into the festivities for Christmas, I want to wish you a Merry Christmas and really happy New Year and new things with all COVID gone in the new year. Even though COVID is still around, we are still celebrating Christmas like never before. And so thank you so much, and I also wish you a Merry Christmas. Now back to the business for this video. So we've been talking about how to come to the UK as a registered nurse from wherever you are practicing as a nurse, but specifically my experience is from Ghana, and so I always draw back on Ghana. So we've gone through passing your your IELTS. If you pass your IELTS, then you go on to your CBT. So after your CBT, what happens is like exchange of documents. So NMC UK will send you some documents online. Some you have to print out, then you have to give to your college, your uni, your school, your workplace, if you are working, if you are not working, to any character reference, and also your registered body like your own nursing council in your country. So after all those documents have been signed, so it's like more of just signing documents, writing documents. Now they want a proof that you are a nurse, and also you've gone to school to study nursing, and you have a pin in your country to practice as a nurse, and it's not just like a fake nurse or a quack nurse that wants to come to the UK to practice. So they really now want to verify how authentic or how true it is that you are a nurse, even after passing all these exams. So if you are able to go through those documents, so you have to send some to your school, the school have to send it back to NMC UK, then it goes through like they call it a queue, which goes through about 30 days, at most 30 days. Then you get a decision on whether they feel okay, it's right for you to come and practice in the UK, or no, we are not satisfied with so and so and so. So when everything is done at this stage, you are going to get a mail that is basically a decision letter. So you are given a decision on all the documents you have submitted, all the exams you've written. They tell you they are satisfied, and then there comes the last in the list of all the exams. Not the list, but yeah, pretty much the list of all the exams you have to write. So when you get a decision letter, now you have to get a job in the UK, and you have to come to the UK and do your OSCEs. So that's a practical exam. But because you can come alone, you can come on your own, you don't have to probably get a job, but it's best to get a job before coming, because if you are coming alone, which means you are coming to write the exam, book your own accommodation, then after the exam you have to go back to your country, because your visa would probably, when your visa expires, you have to go back to your country now, look for a job. So it's all inconvenient. So usually what happens is you get a job in a hospital here, or a care home, or wherever you want to work in the UK as a nurse. You get a job in that particular area, and then those people will now help you process your visa to come to the UK to write your practical exam. Anyway, your decision letter too can also be used for your visa processing, but it's best to just get a secure job. So because why are you fighting for this pin? It's because you want to work in the UK, and so it's best to get a job. Then it makes things much easier and cheaper, because most of the times the hospital or the trust takes almost the whole cost of processing your visa, your flight and everything to the UK. And so it's best to get like a job, apply for a job here, get a job, and then you use that nursing job to apply for your visa, and then with your decision letter you come to the UK. Those things are just basic, like, how do I call it, just normal processes you have to go through. You don't need anything special to go through those processes, and so it's pretty simple and easy. And usually the hospitals will grant you an interview, and the interview is usually on Skype, which I've explained earlier. It's just basic things about where you work, just so they know where to place you. And I would also make a video about the different areas. Even as in adult nursing, we have, because you have the NHS, we have the care homes, we have the private care homes, we have the private hospitals. So where best you want, like depending on what you want, I'll do a video and do the comparisons and the similarities between these different areas. But today I want to talk about the OSCEs. So if you come to the UK, usually your trust, the trust will try and help you, like tuition you towards the OSCEs. They'll go through all the processes and how the OSCEs are done. So you don't have to really do any external learning whilst you're waiting for your visa in Ghana. It's basically the trust is going to help you study for the OSCEs, and they are the ones also going to register you for the OSCE. So it's more of when you are here, it has not ended. You have to also start studying once again for your OSCEs. So the OSCEs is just a practical exam, and for my Ghanaian nurses watching, is pretty much like our licensure, the practical aspect, where we actually go to the ward and use a real patient. Is the same thing. You use a real, but this time around it's not a real patient like when we are doing our licensure. This is an actor or an actress who is trying to mimic a disease condition or a situation where a person is in a hospital. So it is not a hospital setting, it's more like our demonstration room setting kind of. So it's more like a place where they've just partitioned the whole place as a hospital, and where like the actors and actresses are, and they are just acting out and you are also doing it. So the OSCEs is in this format. We have the ADPI, where we call you do your assessment, you do your diagnosis, you do your implementation, you do your evaluation. So that is how the first part of the OSCE is. The first part is more about you are given a disease condition or a patient who has this particular disease condition. So you have to do the assessment. That is the vital signs, as we call it in Ghana, and here we call it observation. So you do your blood pressure, your temperature, your respiratory rate, your pulse, and then your SpO2. So that is the oxygen saturation. So these are the 5 things you do, but we have, that's the basic observation you do. And you can have neuro case where you have to do this observation plus a GCS. So Glasgow Coma Scale, you have to just do a neuro ops on the person. So you do the Glasgow Coma Scale, you do pupil reaction, you do limb, upper limb, lower limb, how they are doing. So these are the observations you do, and this is in the first part. So after these observations, then you will be given a book, where more like a sheet of paper, where you have to write your assessment about the patient. What do you think is wrong with the patient? So you give a nursing diagnosis, just like we do in Ghana, or I think every nursing, they do ADPI, we do assessment, we do diagnosis, we do implementation, we do evaluation. So that is the basic things you are going to do. So you are going to, and planning, sorry, so there's planning in there. So you do assessment, you do your planning, you do your implementation, you do your assessment, evaluation. So after these things, so these ones you have to write. It's not a computer based something, you have to write with the OSCEs. So you write whatever you assess, you do your planning, you do your the nursing diagnosis, you do your implementation, and then you are given an opportunity to evaluate the work. So it's all time based. I think 15 minutes or so, or 15 minutes, but it's really fast. So your hospital will prep you, give you mock exam. So it's you get really prepared before you go in for it. They don't push you in blindly. You get prepared for it before you go for the exam. So after the ADPI, which is constant for everyone to do, then you have 2 skills station. So when we say skill station, that is when you do more like probably injection administration, subcut, IM, urine sample collection, their resuscitation like CPR. You do they've taken catheter insertion now, so you do a sterile procedure like wound dressing, aseptic non-tac technique, so you do ANTT. So you don't have to do all, but you have to learn everything, and you are going to be given 2 out of everything that you learn. So you don't know which one is actually going to come, so you have to just master everything. And because it's within a time frame and you are being recorded too, so there'll be an examiner standing there, there'll be an actor or an actress there, then you are being recorded and you are also being timed. So when it's time, they alert you that, oh, it's time, and then you stop. Whoever you get to, they will evaluate and they know whether you passed or not. So with your OSCEs too, yes, you do basically that first part. There's rest between each and every station. So you do your assessment, you are given some time to rest, take some water, then you go in for your planning, you go in for your nursing diagnosis. So the planning, nursing diagnosis, implementation. So the implementation, you have to actually do it, and usually the implementation is drug administration. So you are given a drug chart, and then you tell what time is it the right time. They'll tell you which time it is in the day you are supposed to give the drugs. So is it the time to give the drug? Is it on your shift? Is it due? Is it not due? Is it correct? Is the prescription right? Is it wrong? What can you correct about it? Is the dose correct? Is the dose wrong? You have to know a little bit about the drugs, not like detailed pharmacology, but just a little bit about what the drug does. Okay, so it's lisinopril, it's antihypertensive. Oh, what does it do? What are the side effects? Like the basic small things about the drug, just to say that you have knowledge about what you are doing and you know why you are giving that patient the medication. So you've probably, in your assessment, you check the patient's blood pressure and it's 90/50, which is very low. Then you come into implementation. It's the same patient, so it's the same procedure. It's the same person you are taking from assessment throughout to evaluation. So you come to implementation, and now you are going to give some drugs or medications to the patient. And then you see amlodipine, which has been prescribed like 5 milligram amlodipine daily, and is due to be given in the morning because it is in the morning and you are doing your drug rounds. Are you going to give that medication or not? You are not going to give it because it's an antihypertensive. This patient is already having a low blood pressure. So these are some of the things they just want you to bring out. Like, you know the drug, you know what it does, and so is it the right time for the patient? Does the patient need it? Does the patient not need it? What will you do? What will you tell the doctor? Or probably, I can't give this medication because this patient is having low blood pressure. The doctor will not be there during the exam, but you just have to explain it to the examiner why you are not giving the medication, or why you are giving the medication and what the medication does. Then you have to explain to the patient. So there will be more like a dummy. During implementation, it's more like a dummy. It's not an actual actor or actress there. It's a dummy you are just talking to, but it's more like the examiner listening to what you are telling the dummy. And if you get a patient to, the patient will just be answering, or sometimes the examiner will be answering on behalf of the dummy for you. So you just tell the patient, oh, this is your medication. Oh, you're allergic to penicillin. Then they've written amoxiclav, then you know that this contains penicillin. So I'm not going to give you this because you're allergic to. So this is the basic things they want to know during your OSCEs. It's nerve-wracking, but it's not anything you can't do because you've done practical exams several times, and so it's just like a practical exam you are doing. Then you finish all these things, then you go and evaluate. After your evaluation, that is the first part of the exam done. Then you have 2 skill stations. So they'll tell you which skill stations you are supposed to do. Then you study. You've already studied it, so you just sit down, relax, and try and retrieve all that you've learned. And then you just do according to procedure, and then you are done. Just like nursing everywhere, when you are putting in a cannula, you have to clean the side. You make sure you're not going to put a cannula in there, but I'm just using that as an example. Okay, let me just use a real example. So for instance, you're going to give a subcut injection and it's insulin, and you're using an insulin syringe. So you have to calculate the drug. How much are you withdrawing? You have to withdraw and make sure you withdraw the right amount. Then you explain the procedure to the patient. You make patients comfortable. So you take whichever part you want to give your subcut, whether it's the arm, whether it's the abdomen, whatever part you want to give the subcut injection. You let the patient know whichever part the patient also feels comfortable. They tell you. So with the subcut, you clean. So you pack everything, you have everything on your tray. So you clean the sides. Then with subcut, because it's a subcut injection, the procedure is you have to pinch the skin. So you pinch the skin a bit, then you go, if it's an insulin syringe and it is insulin you are giving, you go 90 degrees because an insulin syringe has been designed for a subcut, so you don't go 45. But unless you are giving another medication subcut, then you have to go there 45 degrees. But if you are using an insulin syringe, you go 90 degrees. So these are the technical things they are looking out for. So they want to see that you know what you are doing. You are not going to cause any harm to the patient. Patient safety is intact and everything is going to be okay when you get on the field in the hospital. So after your first skill station, it's all is timed. You are going to have to do this within an amount of time, I think 10 to 15 minutes or so. When the time is up, you will stop. They will tell you and you have to stop. There's nothing like cheating because you are also being videoed. Like there's a camera there 24/7 looking at you, and your examiner too, just making sure that everything is fair. Like you get a fair marks for what you are doing. So it's just like a checklist. So they just tick as you are doing, and they make sure you are. It's not, you don't have to get everything on point because then you can't be perfect, like perfect, but you have to be safe. What you are doing has to be safe. And then they know you are nervous, and they know it's an exam. Probably in the real world you wouldn't do that, but because it's an exam, you are tense and the nerves are all coming in, and so they understand that they are going to really reassure you. It's a really calming exam, like you are really reassured, and you go in and like these people are not here to fail you. They know you are a nurse. They know you are qualified in your country. You are safe in your country to practice. They just want to know that you are safe to practice here too. And so you just have to be extra calm, because when your nerves set in, you forget everything. Everything. So you have to just calm yourself down and just do it, and just know at the back of your mind, they are not here to fail you. They are just here to pass you. They just want to know that you are safe to practice, and that is all. So when you finish with your first skill station, you're also made to sit down, get some water, cool yourself down. Then you go to your second skill station, you do it, and then you come out. With your OSCEs, if you write it during a weekday, say for instance, if you write it on Monday, the probability that you get your results on Tuesday is really high. It takes almost like 24 to 48 hours. But if you write it on a Friday, you're going to get your results on a Monday. And that is the most like nerve-wracking period to write, because on a Friday you have Saturday and Sunday to think about the exam, to think about what am I going to get. They don't release the results on the weekend, so definitely it will be a Monday. But whatever be the case, you're going to get your results within 24 to 48 hours. Within 24 to 48 hours. And so it's also very fast. When you get your results, you just go with other procedures to get your PIN. You get your PIN, and then your PIN is given to you. Then you just start practicing. So basically, this is all about nursing in the UK. It's straightforward, it's simple, there's nothing hidden about it. It's out there, everyone knows about it. Just giving highlights and heads up to what to expect. And so if this video is helpful to you, give me a thumbs up. If it's not, you can give me thumbs down, but I believe it's going to be a thumbs up. It's just for your information and just to help you through the process. Watch out for more videos about life in the UK, living as a nurse in the UK, advantages, disadvantages, like challenges and what have you, and also the comparisons I'm talking about with care homes and other places. I'm going to talk to other nurses in other fields, and then we will just compare and contrast as to what to expect when you are coming into the UK to work as a nurse. So basically, that is the OSCEs for you. When you are done with your OSCEs, congratulations, you're a registered UK nurse, and now you can practice safely in the UK. So this is basically my more of like series about your journey from wherever you are to the UK to practice as a nurse. If you have any questions, if you have any comments, just put it in the comments, and I'll be excited to hear from you all. And have a merry Christmas, and we are wishing for a prosperous and more calm new year because we want a very happy new year. We want a new year free of COVID, or at least vaccines being given, and so the death rate and the severity of the condition going down. And so yes, basically it's from me, Vida, to you all in your homes. I say a merry Christmas. Enjoy the festivities safely. Ensure that you are maintaining your social distancing, you are masking up when you are going into you are going out, or you are going where people are. You mask up, and also wash your hands. If you can't wash at a particular time, sanitize. If your hands are visibly soiled, just wash it. When you come home from work, wash your hands. When you come home from town, or when you get home from outside, just wash your hands. Just make sure you abide by the rules so that we all keep safe, and we see each other in the new year, and with more and greater content for you on this YouTube channel. Thank you so much, and have a prosperous new year and a Merry Christmas. Thank you.